I would have been about somewhere between 10 and 12. I remember watching a documentary at home about a young lad of about my age at the time who had cystic fibrosis.
It wasn't until it was mentioned when he was possibly going to be or tested for it that I kind of connected.
And that was it. That was in its entirety. I'd seen that documentary and that was it.
He was about 6 weeks old when I went to the doctors and had a general sort of check-up, mum and baby, and asked any concerns, and I said yes. You know, my baby's not appearing to be putting on weight like the other mums' children's are.
Diane always had this inkling that there was something not right.
And they said, Mrs. Delaney, we'd like you and your husband to come back to the hospital this morning, sort of thing, you know. It's like...
And when you look back now, I mean, if you look at photographs of Ben when he was in his early months, he does look poorly. You know, his skin has got that sort of almost see-through look about it, and it just doesn't look as though he's got any kind of weight to him.
They're not asking us back there for a cup of tea and a bit of cake.
We knew, really, what we were turning up to hear.
I've got cystic fibrosis.
Okay.
And
can you tell me what cystic fibrosis is?
it's a disease.
But it was just absolute devastation, you know.
I felt a bit sick, a bit kind of cold and a bit isolated and...
Cystic fibrosis occurs when both carrier parents contribute their abnormal gene to the new individual. With each pregnancy, there is a 1 in 4 chance of this happening. The principal effect of cystic fibrosis is to cause thickening of mucous secretions within the body. In the lungs, this gives rise to the constant risk of serious infection, with consequent scarring and progressive damage to lung tissue. In the pancreas, thickened mucus prevents digestive enzymes from reaching the bowel, leading quickly to malabsorption and malnutrition if treatment is not promptly commenced after diagnosis.
We sat down at the kitchen table and talked about things like, right, okay, but what are we going to do? How are we going to deal with this? How are we going to go forward? And the things that come up was not, oh dear, how are we going to deal with medicine and how are we going to deal with this? The thing that came up was, right, but he's going to have a normal upbringing. He's not going to get away with this. He's not going to get away with that. He's not going to be allowed to do this, that and the other just because he's got CF. And no, that's right, he's not, no. And that was how it sort of proceeded. And that made it very, that in itself, I suppose, sort of normalised it, you know. Mm. He has nebulised antibiotics, which are colomycin. And he has those twice a day, so he has that in the morning and in the evening. That takes sort of around about 5 minutes to do each time. And that is to prevent the growth, in particular, of Pseudomonas, which is a bug very dangerous to people with CF. We all get Pseudomonas because it's everywhere on taps and around ponds and everywhere that you go. But in the normal way, we cough it up. But because the mucus in his lungs is sticky, rather than coughing it up, it sticks there. And it can grow like a moss. So he has to have this nebulised antibiotic to attack that directly.
When you have a dinner, how many do you normally have? It depends, doesn't it? But what do you think with that one? 3? Well, we'll give you 4. 4. There you go.
Well, when I was having my lunch, that yellowy one I took was a vitamin. And The blue one was a flux, and the white one was Motillium, and then the others was krill.
Creon. What does Creon do? Why do you take Creon?
Helps me digest my food.
Okay. And all the other ones, the flux and the other ones, what do they do?
I don't know.
Okay.
Do they do the same thing?
Okay.
I think they're just good drugs. They're flying slowly.
Right here, pitching up to 800 feet and then recommence back in. To the countdown, waiting. We might turn and listen to the countdown, waiting.
Does it make you different to any other children? Does it stop you doing anything? And what do you think you'd like to do when you leave school?
Start training to be a pilot.
Mind your head. There we go.
What is this control?
The lever, if you raise it, that's the collective. If you raise it, you change the pitch on the blades to increase, so you get more lift, so the helicopter goes up. And if you say move the cyclic forward, it changes the pitch on on just one blade and one location at the time, and that will have the effect of causing the aircraft to the attitude to change and the nose to go lower, and you go forwards.
Well, the cyclic one steers and the other one brings it up and down.
What's your name? Ben, you have a lovely day. Okay?
Do you think of Ben as a sick child? Or do you just think of him as Ben?
I think of him as Ben. In brackets.
No, don't really give that a great deal of thought.
His sense of humour is...
Okay, what's that? Alright, what's that?
No.
No? What's that?
Cream.
Okay, what's this?
Coke.
Someone's about to last sometime.
Yeah, razor sharp.
He's a wonderful, buoyant, lovely little person, and, you know, yeah, I love him. He's my baby.
That's the interview over then.